Good morning. First off, I'd like to note our Florida colleagues who are unable to be with us this morning. Sadly, they're attending the funeral of our late colleague, former Appropriation Chair Bill Young, who was certainly a friend to all here and a mentor to so many of us on both sides of the aisle. He's going to be deeply missed, and particularly in his legacy is the establishment of the bone marrow registry, something that literally will save tens of thousands, if not more, lives, and we appreciate that work. Today, the Energy and Commerce Committee continues our ongoing oversight of the health care law as we examine the many problems, crashes, glitches, system failures that have defined open enrollment. Over the past several months leading up to the October 1st launch, top administration officials and lead contractors appeared before this committee, looked us in the eye, and assured us repeatedly that everything was on track, except that it wasn't, as we now know too well. So why did they assure us that the website would work? Did they not know, or did they not disclose? That's what we're looking to find out with the contractors today and with Secretary Sebelius next week. Companies that are here today all testified before the Health Subcommittee on September 10th about their work building the federal exchanges and healthcare.gov. And in that hearing and in briefings with committee staff, these companies represented that the exchanges would be ready for open enrollment on October 1st. They also explained that their testing of the system had not identified any significant problems. This is not about blame, it's about accountability, transparency, and fairness for the American public. The broken promises are many. The President promised Americans that they could keep their health plans if they liked them, no matter what. Yet here we are, 24 days into open enrollment, and more people are receiving cancellation notices in just 2 states than the 476,000 Americans that the administration boasts have begun applying in the entire country. This is a troubling fact, but we still don't know the real picture as the administration appears allergic to transparency and continues to withhold enrollment figures. This is more than a website problem, and frankly, the website should have been the easy part. I'm also concerned about what happens next. Will enrollment glitches become provider payment glitches? Will patients show up at their doctor's office or hospital to be told that maybe they aren't covered or even in the system? In a few months, families in Michigan and across the country are going to face penalties under the law's individual mandate. How can the administration punish innocent Americans by forcing them to buy from a system that does not work and whose rollout has been nothing short of a disaster? The American public deserves answers. Today we're going to get them from the lead contractors. Next week will be Secretary Sebelius' turn. I now yield 2 minutes to the Vice Chair of the committee, Mrs. Blackburn.